few of the different items that you might carry in your kit. So your IFAK, depending what pack you want to carry on, whether it's in your backpack, whether it's on your webbing, on your belt. So these are quite large, right, and you can fit quite a few items in there. You can get the smaller ones as well. Anything that essentially that you can put your hemostatic agents into. Okay. So the two most commonly ones that are on the market at the moment is your quick clot, used quite commonly by militaries around the world, and your Celox. Okay. There are slight differences to the two, but it's really important to note that if you don't have a hemostatic agent, we can still just use normal gauze. Alright, so just a normal crepe bandage. Right, and then as well you can get these bandages specifically designed for wound packing. Okay, you can see that they are nice and tightly compressed so that you can fit them nicely into your kits and not take up too much room. The biggest difference between the quick clot and your Celox is what's impregnated with. Alright, so you've got kaolin, okay, or kaolin, how you want to pronounce it, right, and that's going to work with the body's clotting factors. So you might find it a little bit difficult, especially if your patient is really hypothermic, okay, or maybe they're on blood thinning medications too. The difference with the Celox, so it's impregnated with chitosan or chitosan, depending where you come from and how you want to pronounce it, and these work independently to the body's clotting factors. So definitely some benefits. A lot of the studies show that there's not a major difference, all right, but it's just something to be aware of when you're deciding what item you want to carry in your kit. The really good benefits of using a hemostatic impregnated gauze is the way or how quickly that clot is going to form when you start to apply it, as long as you've applied it properly. Just with non-impregnated gauze, so just a normal crepe bandage, or your bandage is designed specifically for packing, so still just a normal crepe bandage, but just packaged a little bit differently. Alright, those are going to take a little bit longer, but you can still achieve the same goal. So please don't just think if you don't have hemostatic agents, we can't pack a wound. Definitely grab out your gauze and start packing that wound properly, which we're going to go through very, very shortly.